Hi, I'm Brandon Watson, and I'll be doing a cranial nerve and then head, neck, and face exam on my brother Brian here. And first, I will show you around the room. All right, so the first cranial nerve we're going to do is cranial nerve number 1. That's the olfactory nerve, which is a sensory nerve for smell. In order to do that, I'm going to have you occlude your nostril, take a deep breath in and out, and we're just checking for patency here. Now that we've confirmed that, I'm going to have you smell. Tell me if you can identify the scent. And he is not able to do so. This is consistent with his past medical history of a brain injury where he lost his sense of smell. So cranial nerve 1 is not intact. Next, we're going to move on to cranial nerve number 2, which is the optic nerve. We're going to test his vision, first using the Snellen eye chart, which is 6 feet away. In a moment, I'm going to instruct him to cover his left eye, or right eye, and then read the lowest line that he can. So go ahead and do that.
LTFPH.
All right, so he got all the letters correct for the line 20/20, indicating that his vision is, at least in his left eye, is 20/20, and that he can see at 20 feet what a normal person can also see at 20 feet. Typically, we're just doing this one-sided for the test sake, although typically we would do both eyes independently and then together, both with and without corrective lenses. So normal findings there. However, you can actually miss up to 2 per line where it's normal. If you miss any more than that, you would want to move up to the next line. Next, we'll move on to the confrontation test, which is going to look at his peripheral vision, where I'm going to have you cover your right eye. I'll cover my left. And let me know when you can see my finger come into your field of view here. So ready? Oops.
Yep. 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 Yep.
All right. So his peripheral vision seems to be intact. I can base this based on knowing that my own vision is intact and that my hand is equidistant between myself and him, and coming into view at the same time. Anyway, so that test is normal. We're next going to do the fundoscopic exam with the ophthalmoscope, and we'll take a look at his eye directly. First, we're going to be looking for a red light reflex and looking at all 4 quadrants of his eye. I'm going to go ahead and do that first, and then I'll discuss it a little more in just a moment here. So, all right, look straight across for me. And then I'm able to visualize the red reflex. I'm going to come in a little bit closer now. All right, and so he has a normal exam where I'm able to visualize first the red light reflex. Had that been diminished, we would consider pathologies like retinoblastoma or cataracts. You would also see it absent in the case that someone was missing an eye altogether and had a false one. Other things I'm able to visualize would be his optic disc, which had normal margins. I'm also able to see the physiologic cup. Its relative size to the optic disc was normal in that it's less than 50%. Had it been greater than 50%, I would consider pathologies like glaucoma. I'm also able to see the vasculature of his eye, including the ratio of veins to arteries and just how they look generally. I didn't see any cottonwood appearance there, nor did I see an abnormal proportion of the two. Sometimes you can see abnormalities there in the case of things like hypertension or diabetes. I then was able to visualize, the macula as well as the fovea in the eye without noting any macular degeneration. So next we'll move on to cranial nerve 3, which is the oculomotor nerve. We're going to test that his eyes are perla. Perla standing for pupils that are equal and reactive to light bilaterally and to accommodation. So let's see. So I'm going to shine the light in your eyes as you look straight across here. And at first I'm going to be looking for direct constriction of the pupil. So I'm going to shine it in his left eye and look for the left eye to constrict. Anyway, okay, that constricts appropriately. Then I can also look for consensual constriction, meaning that I'm going to look for his opposite eye to constrict. And so when I do that, I'm going to shine the light in your eye, and the right one constricts to light in the left eye. After that, I'm now going to look for accommodation. I'm going to have you follow the pen with your eyes. As it moves closer, I'm able to see your eyes converge on the pen and your pupils constrict. So those findings are normal. Let's see. So next we can do check for the light reflex, corneal light reflex. So I'll have you look straight across the room again. And when I shine the light on your eyes, I can see the reflection in both pupils are equal, indicating he has a normal field of gaze. The next test I'm going to do is the cover-uncover test, where you'll cover your eye for about 10 seconds. And I'm looking for any signs of strabismus. If he does have strabismus, I'll be able to see the uncovered eye, the non-covered eye, correct either when he's covering the opposite eye or taking it off. And as a reminder, all of these exams are actually normally performed bilaterally, even though I'm performing them unilaterally today. Anyway, go ahead and cover your eye as you're looking straight forward. And I don't see any correction of that eye. And then you can go ahead in 3 more seconds and take it off. And again, I see that he has a normal gaze all throughout that exam. Next will be the extraocular movements of the eye. That's going to be inclusive of 2 other cranial nerves. So it'll be 3, the oculomotor nerve, in addition to the trochlear nerve, which is cranial nerve 4, and the abducens nerve, cranial nerve 6. All of these are motor nerves, for the record. And I'm going to go through the fields of gaze and check for any abnormal extraocular movements. So first I'm just going to go left to right, looking for any nystagmus. He doesn't have any nystagmus there. And now we'll go through all 6 fields of gaze. So starting all the way up, down, and across, and down, with a normal field of view in all 6 there. And then, let's see, after that, we can go on to, the trigeminal nerve, where I'm going to test both, and this is nerve number 5, I'm going to test both sensory and motor function. And in order to do that, I'm going to just show you on your hand what it feels like. That'll be sharp, that will be dull. I'll have you close your eyes and then tell me if you feel sharp or dull on your face.
Sharp. Dull. Dull. Sharp. Sharp. Dull.
All right. On all 3 major branches of the trigeminal nerve, he's able to appropriately differentiate sharp and dull, and clearly has sensation intact there. Another sensation test we can do for the trigeminal nerve is doing the corneal reflex. This is where I'm going to have him look away, and not that I'm actually going to do it right now, but with a soft object, maybe a tissue, I can touch his cornea, and it should elicit a blink response there. Because he's conscious, I'm not going to do it on him right now. We can also move on to testing the motor function of the trigeminal nerve. In order to do that, I'm going to have you move your jaw left to right, and then open your jaw, and then clench it down. And I'm able to feel good bilateral muscle strength there. Moving on, I'm going to test cranial nerve number 7. This also has sensory and motor function. In order to test sensory, I'm going to test the anterior two-thirds of your tongue. And this is going to test for taste there. So I'm going to have you identify the taste. This will go on your tongue. Sweet. All right, so he's able to appropriately identify the taste. I'm also going to have you blow out your cheeks, and then smile, and then raise your eyebrows up and down. Good. so he has appropriate motor function there as well. Next, we'll move on to the auditory nerve, which is cranial nerve number 8. And in order to do this, we'll start with a whisper test, where I'll have you occlude your right ear. And although we would normally do this bilaterally, we'll do it unilaterally here. I'm going to whisper into his ear and have you tell me the few things that I'm whispering to you.
Star 1. Triangle.
Okay. All right. He's able to appropriately hear on the whisper test. After that, we're going to move on to the Weber test. This is going to test for the lateralization of sound. And in order to do this, I'm going to have him tell me if he hears better on left, right, or if he hears equally when I put this on his on top of his head. Ready?
Equally.
All right. So that's a normal exam finding. Had he heard better on one side or the other, we would consider pathologies such as conductive hearing loss, in which case you would hear better on the affected side. And then in the case of sensorineural hearing loss, he would hear better on the unaffected side. However, it's normal here. This test is coupled with the Rene test, which I'll do in a moment, where I'm going to put this behind his mastoid process, and he's going to identify for me when he can no longer hear it. And then I'm going to pick it up and hold it next to his ear, in which case he's also going to identify me a second time when he can no longer hear it. And we'll be looking at the ratio of those 2 times. So you'll say yes 2 times in a row, essentially.
Yes. Yes.
All right. So that is a normal test finding for him there, in that the ratio was approximately 2 to 1. Had it been closer to a 1 to 1 ratio, we would be concerned for sensorineural hearing loss, in that when I take it off his mastoid process, he would not be able to hear as long through his next to his ear, or not at all for that matter. So normal findings thus far on the hearing exam. After that, we can move on to let's see, cranial nerve 9 and 10, which are the glossopharyngeal nerves, which is 9, and then the vagus nerve, which is 10. Both of them we can test certain functions, not all of them in this setting though. So they both have sensory and motor functions. For the sensory component of the test, I'm going to test the posterior 1/3 of his tongue and have him identify the taste here. You ready?
Salty.
Salty. All right. So he's able to appropriately identify the taste there. And then another component of the sensation part of that is that I can also do a gag reflex. I'm not going to do that in this setting. I can also look for an equal rise and fall of the uvula. That's going to, well, I guess those are both motor parts, both the gag reflex and equal rise and fall, which I can test for. The other sensory component I can test for is simple sensation to the posterior oropharynx. All right, say ah. All right, so I see it's equal rise and fall of the uvula. So that's cranial nerves 9 and 10. Moving on to cranial nerve 11, which is cranial nerve 11 is a motor nerve. That's the spinal accessory nerve. I'm going to have him raise his shoulders against resistance here. So raise them up, and then turn your head left and right against resistance. He has normal strength, equal bilaterally, indicating that it's functioning properly. Moving on, we have the 12th cranial nerve, which is a motor nerve, hypoglossal nerve, essentially testing the function of his tongue. In order to do that, I'm going to have you stick out your tongue for a moment, all the way out. Good. And it appears midline, and then I'll have you poke your tongue out to the right and then to the left through your cheeks there with good strength, equal bilaterally, indicating that this one is also intact. So that's our cranial nerves, and then we'll move on to the head, neck, and face exam, starting with looking at his hair. His hair is brown, silky, and smooth. Um, Sometimes when we're looking for certain pathologies, we would be looking for hair that is brittle. Makes us think about either like anorexia or hypothyroidism, or even you could say thin for that matter. Other pathologies would be, in the case of brittle would be hyperthyroid. Greasy may be hypothyroidism, which I do not see as overtly greasy. Next, we'll be looking at his scalp for any lesions, abnormalities to his skin, protrusions, crepitus, both inspecting and then palpating, actually. It looks normal to me on inspection. And then after that, we'll move on to his skull. Looking at his skull, I don't see any deformities. It's symmetrical, and his skull is normal cephalic, and that is similar in proportion from head to body. After that, let's see. We'll look at your face here, and his face appears to be symmetrical without any gross lesions or abnormalities there. What I'm going to do is palpate your sinuses. So palpate here for the frontal, the mastoid. Does that hurt at all?
No.
All right, so no reproducible tenderness, and those are the perinasal sinuses. And then next, I'm going to look at his ear over here. First, looking at the skin, inspecting for any gross lesions, abnormalities, drainage, edema, redness, and it appears to be within normal limits. We're going to then do the tug test, which includes pulling up on the auricle, down on the pinna, and pushing on the tragus. None of this seems to elicit any pain, or I don't see any tenderness associated with this, so that's a normal finding. If it did elicit those things, we would consider pathologies like otitis externa. After that, I'm now going to take a look inside his ear. Given that he's an adult, I'm going to pull it up and back. And we'll take a look. And then also just inspecting kind of into the ear canal. I don't see any foreign bodies, drainage. So on exam, I'm able to visualize the external ear canal is completely, it looks normal, just a tiny bit of cerumen, no foreign bodies, no redness, edema, drainage. And then looking at the tympanic membrane itself, I'm able to see that it's intact. Also that the tympanic membrane is pearly gray with a cone of light at 7 o'clock. I do not see any signs of like bulging, retraction. I don't see any fluid behind the ear or tympanic membrane either. So good finding there on the ear exam. Next, I'm going to take a look at his nose. In order to do that, I'm just going to generally look at your nose. I don't see any deviation, nor do I see any lesions, abnormalities, protrusions there. Next, I'm going to have you look up. I'm going to look into your turbinates here, so go ahead and look up. All right. On exam, his mucous membranes are pink and moist, which are normal findings. I don't see any deviation there, nor do I see any drainage, edema, erythema, so normal findings. And then the last part of the nose is I'm just going to have you bilaterally test one side and then the other, and take some deep breaths. We're just checking for patency bilaterally. You can see abnormalities there with septal deviation. Next, we are going to take a look at your ears, or not your ears, your mouth. So I will have you open your mouth for me. And by the way, just looking at his lips look pink and moist. I don't see anything like fissures, dryness, or cracks there. So looking in at his mouth, I'll actually, let me use a pen light. I will take a look at the buccal mucosa first. I don't see any lesions or abnormal colors. It's pink and moist as is appropriate. Oh. Oh man, I thought I stopped for a second. So next, looking at your gums, it looks pink, moist, and appropriate for his race, essentially. And I don't see any redness, swelling. The margins of the gums are tight and sharp. So no signs of things like gingivitis. Next, I'm going to look at both his hard and soft palate, and then move on to his teeth here. So both the hard palate is symmetrical and looks appropriate, as is the soft palate. Looking at his teeth, they appear to all be in place. No missing teeth, no dental caries noted, nor do I see any broken teeth. After that, I'm going to have you say "ah" one more time. I'll look at your tonsils and posterior pharynx. It looks pink and moist without any signs of redness, edema. The tonsils are +1 bilaterally, which would mean that I can identify them. However, they look small. No obvious exudates, swelling, or abnormalities there. The posterior pharynx looks good as well. No postnasal drip noted. Nor do I see any redness there. Next, we can move on to looking at your neck. On your neck, I see that your trachea is midline, and your neck generally appears symmetrical. I don't see any asymmetries there or signs of excessive accessory muscle use. So palpating your trachea, it appears midline. I will stand behind you, and this is where, I got your cup of water. I'll have you take a sip of water and hold it in your mouth, and then looking down and to the right, I'm displacing your trachea with my right hand and palpating down, and then take a swallow. With my right hand, I was feeling for his thyroid. I didn't feel it on palpation, which is a normal finding. And by the way, I don't see any goiter to his neck either, which would be another finding consistent with thyroid issues. So normal findings on his neck thus far. The next component I will look at will be his lymph nodes, starting with preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial clavicular, deep clavicular, supraclavicular, and then intraclavicular. With his lymph nodes, they aren't palpable. Those are normal findings as long as they're less than 1 centimeter in size, that they are soft and not fixed. Had they been fixed, greater than 2 centimeters, tender, that would be abnormal findings. That's the end of my exam for video 1. Thank you.